So in this video, we're going to explore what is dry needling, what happens when we use dry needling in regards to using it on muscles that might feel a bit tight or sore, and also how that then might help an Achilles tendonitis or tendinopathy, and what are the pros to this and what are the cons to this. Hi, I'm Ali. I'm one of the physios from treatmyachilles.com. We're an online physiotherapy service treating all different types of Achilles injuries. We do this by a video call, and if you would like to find out more information about our service, please have a look at the links below. So first off, let's talk about what is dry needling. Well, dry needling is a type of acupuncture. It is not the same as the traditional acupuncture theory where we're looking at energy flow. This is very different. This is looking at using a particular small needle, so a normal acupuncture needle. That normal acupuncture needle comes in a plastic tube. That plastic tube is the bit that touches your skin. Then we take the stopper out the top, and your practitioner who's trained in acupuncture will then tap the top, and then that needle goes into your skin. That then goes down into a muscle that's feeling quite tight or sore. We used to call these terms trigger points, and now there is some debate about the use of the literature trigger point, and we'll come on to that in a moment. When this needle that's very fine, which is quite difficult to see, it is so bendy and so pliable that it is not like having an injection at all. When that needle goes into that tight muscle, that muscle reacts to it, and then you feel like a gripping, tightening sensation. It can be a little bit zingy. I think that was one of the best descriptions I had by a patient. And then that starts to ease off. There's also debate whether you then go back and twiddle or move that needle if you're the practitioner to see if we can get more response. Some people just leave it there. That takes a few moments to go, and as that sensation goes of when you know that that needle's there and now you can't feel it anymore, the practitioner comes and removes it. If we then were to have a look at your calf again, you might find that it feels less tight, less tender, and less sore. So again, this may be related to the old term of trigger points. Trigger points were areas in the body where we were said to find like a knot or a tightness in one specific area. We would then have maps with where traditional trigger points might be found in the human body. But when this has been looked into in a bit more detail, it's been found that, well, where I might find a trigger point in your body might be different to the next clinician that you see or the next clinician that you see, regardless of whether they were doctors, physios, acupuncturists, sports therapists, or whoever else had trained in that technique. So therefore we couldn't replicate them easily in trials, and it became quite difficult to measure. So you may still see the term trigger point written in research or on online blogs. Essentially, it just means an area of tension or tightness in a muscle that's not relaxing no matter what you do to try and help it. So there's lots of debates in the research and lots of theories being proposed as to why this might help these tight muscles. Nothing's been absolutely definitively proven, but the general theory behind this is that when our muscle is unhappy, it creates more tone and tension inside it due to a decrease of blood supply in that area. And if we were to put a needle into that area, we're increasing that blood supply to that part of the muscle, and therefore it's getting fed, it's getting happier, and it starts to relax. We then need to look at whether we can use this directly into the tendon itself. It is very difficult considering I showed you how fine that needle is, and I appreciate that's now bent since I twisted it earlier, compared to pushing it into something really thick tissue that is a tendon. So the theory being is that it helps disrupt the process of what's going on in a tendon. So if you would like to find out what goes on in an Achilles tendon when you get a tendonitis or a tendinopathy or tendinosis, we've got some brilliant videos going into real detail of that, and you can find the links below. Essentially what we're looking at is a process that's been ongoing for a while within that tendon, where there is a disruption of a very small portion of the fibres of that tendon. And that disruption means that those fibres are not as lined up as they normally are, and therefore, again, a little bit unhappy or a little bit more disorganised. And the theory is that if you were to put a needle directly into that tendon, you would disrupt that process and cause, again, more of a healing response to that. That has not been proven. It's very difficult to prove, so it is unknown whether that makes much of a difference to the actual structure or to the actual change of the pathology that happens when you get an Achilles tendonitis. So there's been some research on dry needling and about whether it actually changes the tendinopathy side to it. And there is a couple of systematic reviews, one being the most recent. So a systematic review means that they've looked at the research that has come out over a period of time. They've checked the quality of that research about their inclusion criteria. So do they want to include it in this study or not? Was it a robust piece of work that you can compare to other studies? And then they drew conclusions based on those studies altogether. And that they agreed that it was really safe, that it was effective in symptom relief in the short to medium term, and that it, compared to other symptoms, it can be really great as it's non-invasive. So some of the other things it was compared to would be different types of injections. So those injections are when we're injecting a substance, such as your PRP injections, which again, we've got videos in our back catalogue. So if you're comparing dry needling to something where you're injecting something, then it's been shown to be the same or safe and comfortable in comparison to that. What was interesting is in that systematic review, they couldn't agree, all of these different papers, on how many needles, where they would put the needles, how long the session was, how long the needles were in for. Do you manipulate them and twiddle them and twist them? Or do you leave them well alone? So it was quite difficult to compare it. So there's a real acknowledgement in this study that more evidence base is needed. There wasn't anything in research looking at, well, does it change that pathology in that tendon, that change of that collagen fibres or of the fluid accumulating in between of those collagen fibres that are affected? Or indeed, does it change anything to do with the ones that are not affected, the vast majority of your collagen fibres? And nothing has been looked at for that. So it is very difficult to say that it changes anything when we're looking at the pathology or structure of that tendon. We've got a brilliant video as well discussing about tight calves and Achilles tendonitis and what does one cause the other, or are they symptoms of each one? But a tight feeling in your calf or a restricted range of movement is really common with Achilles tendinopathy, especially one that's been going on for a long period of time. So going to see a practitioner face-to-face who may do some work on loosening off that area, particularly the calf itself, not necessarily doing anything directly to the tendon. And again, we've got videos based on describing why we think that's not such a great idea to do things directly to the tendon. But if you were looking at helping to relax that muscle in that calf, that can help relieve quite a lot of symptoms. Now, these symptoms are not the symptoms of your tendinopathy, so they may not be the case where you have a pain reaction after you've done an activity and then later that day or the next day you get a pain response from that. Or it is the stiffness feeling you might get when you first wake up in the morning and start to walk, or you've been sitting for a while, get up and start to hobble. Now they're symptoms of actually what's going on inside the tendon itself. The symptom relief this comes from is making things feel a bit looser, a bit easier and a bit freer because those calf muscles are more relaxed. So it is brilliant in that, and I would use that with patients if I were seeing them face to face. is this the be all and end all in Achilles treatment? And if you were to just come and see me and I was to relax your calf muscle, well, we could do that on repeat over and over again. But if we're not addressing what's happening in that tendon or what's happening in your life or your sports and activities that could be causing this Achilles tendinopathy or ongoing symptoms, then we're probably not going to get to the root cause, and you'll just keep coming in and paying me money to do this. So I would use this technique alongside strength work and load management. So there's lots of videos that we've got here about our load management or relative rest. We've also got lots of videos on training errors and things that can happen typically with people when they haven't got that area managed. We've also got lots of videos based on the strength management and all different types of strength exercises. So I would go through my assessment, find out where people are on those two things, get them set up, make sure that they're happening, make sure we're progressing and getting those to be more difficult over time so people can get back to their activity. And then any time left in my appointment, I would then use something like dry needling or massage to try and relax these calf muscles to make things feel a little bit more comfortable. So in conclusion, the pros of using dry needling is that it can be brilliant at symptom relief, particularly for tight muscles and calf muscles, and that feeling of restriction of range of movement in the short to medium term. It's safe if performed by a practitioner that has been trained in acupuncture, but it may not affect the Achilles tendon itself, and it doesn't necessarily address the reasons why you were getting that tendonitis or tendinopathy in the first place. So therefore, it would be used alongside the treatments that have got the evidence base, which is the load management and the strength exercises, the progressive strength exercises over time. Thanks for listening.